Hello, everybody. We're in week 14 and we'll be covering chapter 14, Psychological Disorders. Your to-do list is here for the week. Let's take a look at the learning objectives for this chapter. It is a very packed chapter. There are a lot of disorders to cover, and we won't be covering all of them. You guys will learn about the DSM, which is the Diagnostic and Statistical Manual, that categorizes and classifies all psychological disorders for helping in diagnosis. And you're going to learn that there's a ton of different categories of mental illness. We're going to cover the major ones, at least in this class. But if you're interested in this topic, and a lot of students are, you might consider taking abnormal psych, where you'll go really in depth into all of the different disorders and classifications. So for the purposes of this class, we'll take a look at how we define abnormal behavior and how that definition has changed over time, and what kind of models we use to explain psychological disorders. And that's where the DSM comes in, and it starts to classify the various disorders into categories. And then you'll see how a diagnosis is made, what kinds of criteria need to be present in order for an individual to be diagnosed with a mental disorder. The first category of disorders that we're going to look at are mood disorders, which includes major depressive disorders and bipolar disorders. And we'll take a look at comparing and contrasting different explanations for depression, its etiology and such, and other disorders of mood. And in fact, your discussion question for the week revolves around a possible etiology explanation for depression based on the work of Seligman and Meyer. So we're going to take a look at that in just a second. The next class of disorders we'll look at are anxiety disorders. What are the symptoms that need to be present? What would a person be feeling, in other words, if experiencing anxiety? What are the different types of anxiety? So we're going to look at generalized anxiety, things like PTSD, phobias in general, and a few others. Then we'll take a look more specifically and spend a little more time on obsessive compulsive disorder, or OCD, and stress-related disorders. And a lot of that can be due to trauma, different triggers in the environment. So we'll look at some potential causes of that. Then we'll turn towards looking at dissociative amnesia, dissociative fugue, and other dissociative identity disorders, which used to be termed multiple personality disorder, where a person literally has a split in their personality or identity and causes confusion and some chaos in the person's life. So how that happens, we'll have some possible explanations, some different symptoms and diagnoses there. Then we're going to turn to looking at some eating disorders as well as sexual dysfunction disorders, before we then spend a good portion on personality disorders. And again, within the personality disorder category, there's many different subtypes. We'll be looking at borderline personality disorder, antisocial personality disorder, and some others within there. And again, some potential causes of personality disorders. The last category we'll take a look at is schizophrenia and how it breaks down as a whole. We kind of see it as having positive symptoms and negative symptoms. So things that are present and adding conflict to the person's life, and then things that are absent or detracting, taking away from the person's life in absence of particular behaviors, perhaps. And we're going to evaluate the biological and environmental influences on schizophrenia because we've seen a good deal of influence from both these areas. And then lastly, they're going to round off the chapter with some ways to overcome test anxiety, which is a very common type of anxiety that I think everybody might feel at some point in time. So that is pretty much your chapter in summary. Here are your interactive lecture slides. And again, please be watching the videos that are embedded in there, as well as the videos that are embedded in your e-text reading as you're going through that. If you're doing the audio option for the e-text reading, make sure you're spending time going back and taking a look at those videos that are included there. There's some really great ones. I've added several this week, so a little heavier on the videos because we have so many categories. And I like to give you guys a good sense of the different classes of disorders. So you're going to see I put in several of the crash course videos. This one is just psychological disorders in general. It's a great overview before then we start getting into specifics. This one deals with OCD and other related anxiety disorders. And I have a couple examples there. This is Chad and a day in the life of his OCD. You'll see how he struggles with that. And then Howie Mandel, who also talks about living with OCD. And they both have different types of OCD. Chad's is more having trouble going out in public. There's lots of triggers for him. And Howie's is more germs and things that are dirty that he fears. And then there's a video on depressive and bipolar disorders. Bipolar has the depression side and it has the mania side. So it's classified in mood disorders as well, along with depression, major depression. Here is a video giving you a good overview in particular of bipolar, what the symptoms are like for people, what people experience, and kind of a day in the life of somebody struggling with that disorder. And then this is a crash course on personality disorders, and it actually does a really good job of breaking down each different subtype of personality disorder. Some can be very similar, share similar traits, and some have some more unique identifying features. And they can certainly overlap a little bit. What you're going to notice with a lot of the mental illnesses is that they're very comorbid with one another. So a person could be experiencing a mood disorder while also experiencing anxiety or PTSD. Somebody might have schizophrenia, but also bounce between periods of mania and depression. So they could have some bipolar disorder in there. And a lot of times people who are suffering from physical illnesses experience various mental disorders along with that. So for example, depression could be comorbid with heart disease or a cancer diagnosis. Here's a carve-out video of borderline personality disorder, so you can understand some of the symptoms there. This tends to be one of the more prevalent disorders within the personality category. If we look at statistics, what we know is that more people suffer from BPD than any other personality disorder. Also prevalent is antisocial personality disorder. This actually makes up a good deal of individuals who are incarcerated, and you're going to see why that's the case. What about this leads to violence and or troubled relationships and or getting in trouble with the law. And then I put a crash course video, your last one, on schizophrenia and dissociative disorders, dealing with identity. So there's several videos. They're all very short, less than 10 minutes each, some less than 5 minutes. So makes it easy. And I mean, I would recommend, like, as you read about a particular class of disorders, go ahead and watch the video along with it. So I would actually advocate for you stopping your reading, watching the video that goes along with, say, OCD and anxiety as you're reading it, and then go on to depressive bipolar disorders, read it, watch the video, and kind of work through it in that way so that you're getting a good sense of these as you're reading about them. And that's kind of how I would do it in lecture, in classes. Every time we cover one class, I would show a video to demonstrate what it is the material is covering. So here's your discussion for the week. As I said, it covers the work of Seligman and Meyer. It's called Learning to be Depressed. It's Hawk Reading 8.3. And so it deals with a little bit of conditioning, which we've talked about in the past, behavioral conditioning, and just how much control in one's life plays an important role in emotional well-being. How does it do that? That's your task for this week, is to explain that, and how their work contributed to the study of depression, and really understanding the etiology, the cause of depression. Where does it possibly come from, according to these researchers? And also then stating what approach do you think that they use to understanding depression. And we've talked about a lot of different perspectives in psychology: cognitive behavioral, humanistic, different levels of understanding what or why a certain disorder might occur, like what's the cause. And as I've always said in the past, not one is correct. There isn't one correct pathway to understanding mental illness. They each kind of have their own unique contribution to kind of digging into how to help people. So your next chapter, chapter 15, is going to deal more with psychological treatment, therapy. So this chapter is really pivotal in that it's setting you up for understanding each disorder. And then in the next chapter, okay, now how do we approach it? You got to understand the prevalence of each disorder and what a person's experiencing with that. And then we can talk about treatment and how we might attack giving therapy to a client. So that is the discussion. And then you guys have a quiz this week over this chapter. And that rounds off the week for you. As you're working through this material, definitely please let me know if you have any questions at all. And have a good week, everyone.